Hi, next we're going to talk about the benefits, impact, and disadvantages of home mechanical ventilation on the family and patient. Home mechanical ventilation is cost effective. The demand for controlling healthcare costs has enabled high-tech care such as home mechanical ventilation to be provided in the home. Home mechanical ventilation is 70% less than ventilation in an ICU bed. Home mechanical ventilation is less stressful in the home setting versus the hospital setting. The patient will have improved quality of life. The home setting provides for the patient's greatest independence. Example, the ventilators have wheels on them and can be moved from room to room. Here's a picture of a ventilator with wheels. This is what most positive pressure ventilators look like. And then here is a picture of the same ventilator detached from its wheels, where it can be set along a tabletop or a bedside table. The settings on home ventilators are simpler than those in the ICU setting. Positive and negative pressure vents can be used in the home. Negative pressure vents are easier to use because they require no artificial airway. Here is a young man on a negative pressure ventilator, and as you can see, he has no endotracheal tube or tracheostomy. New technology provides for small, compact, laptop-sized ventilators for traveling and even horseback riding, as this young girl is doing here. And yes, that is her ventilator on her side as if it was just a carry-on bag. Now tell me that's not convenient.
It is.
There are no risks for hospital-acquired infections. Patients are placed on priority lists with the telephone and electric companies in the event of power outages. No limit on visiting hours. The patient will have enhanced social relationships. Family members are readily available for care, and no trips to the hospital. The impact on home mechanical ventilation. The family will now have to provide 24-hour care and may not realize the sacrifices to be made. Respite workers will be needed so family members can rest. Financial and commitment issues may arise. Job schedules may have to change, and children of the household become involved in the care. And children should be taught the safety measures and the do's and the don'ts of the ventilator. Plans in case of an emergency will have to be discussed with everyone living in the household. Neighbors, such as EMTs or nurses who could be of assistance, should be aware of the mechanically ventilated patient in the neighborhood in case of an emergency, and neighbors may be glad to give support when needed. One disadvantage of the home mechanical ventilator is that disposable supplies are not reimbursed with healthcare insurance companies. So the patient most likely will be sent home on the metal trach with a metal inner cannula that can be removed and cleaned with half-strength peroxide and normal saline. Some of the complications are cardiovascular, whereas there will be a decrease in venous return from the heart due to the pressures that increase the intrathoracic pressures, and the decrease of transmission of airway pressure to the heart and the heart vessels with patients with acute respiratory distress syndrome. Pulmonary risk include barotraumas, which are too much air in the alveoli, and volutrauma, which is a large tidal volume in patients with acute respiratory distress syndrome. Alveoli hypoventilation can occur for many reasons, and a few are a leak in the air, a leak in the trach cuff or tubing, lung secretions, a low SINV setting, or a too low tidal volume setting. And alveoli hyperventilation can occur if the patient is hyperventilating or if the tidal volume setting is too high. Patients with COPD are at increased risk for this. Managing pain, oxygen therapy, support, and comfort may decrease the occurrence of this. Quality control of the home mechanical ventilation equipment is important to ensure patient safety and that patients are receiving the correct amount of pressure support. It is imperative to have regular maintenance and safety checks done on the home ventilator and the equipment. Although improvement varies with the underlying disorder, studies on home mechanical ventilation have shown an overall improvement in health-related quality of life with all patients.